In order to understand the different drugs to be effective in cardiac arrhythmia, one must know the different mode of treatment of cardiac arrhythmias. And the different modes of treatment of cardiac arrhythmia is number one, the vagus stimulation, the carotid stimulation. Number two, it may be the cardiac surgery. At times, we just cut some aberrant pathways in the heart. At times, we give the pacemaker, which is an electrical device which gives the heart the rhythmic activity, or it can be tackled by the different pharmaceutical means. Why there's a rhythm disturbance? The reasons are, number one, there may be ischemia, there may be aberrant vessels, or there may be some defect in the pathway of the conduction of the pacemaker activities, or there may be some ectopic pacemaker activities, or there may be some other electrical activities which are responsible. So normally what happens, so this is the cardiac muscle. So there are the four phases of the cardiac action potential. The first, the sodium channel opens up, and when it reaches up to 20 to 30 positive, on that time the sodium channel closes and the potassium starts going inside, what we call the high repolarization state. Then from here, potassium once again stops entering the cells, calcium comes inside the cell, and here the potassium once again starts entering the cell, and the cell ultimately gives a normal. This is the normal action potential, different phases. So these are the action potential of the cardiac muscle cells, is not of the sinus, not of the pacemaker activities. In the pacemaker activities, all these four phases cannot be well established. When demarcated, it's like this: 1, 2, 3, 4, 0, 1, 2, 3, and 4. So here, the second phase is more important because the entry of the calcium is important. Now, the rhythm disturbance may occur because of the generation, faulty generation of the rhythm, and number two, defect in impulse conduction. As you know, so there's the heart muscle. In the here there's a sinoatrial node which is set to the pacemaker. From there it goes to the AV node. Through, it is conducted like this. Now from there it goes to the interventricular septum, and ultimately it is the whole activity is conducted in the whole muscle. This may produce this may be hyperactive, what is called the tachycardia, or it may be less active, we call it the bradycardia. The different phases are the 0 phase, 1 phase, 2 phase, 3 phase, and the 4 phase. And this period we call as the action refractory period or action potential duration. So up till this phase, heart cannot be re-stimulated because it is in the absolute refractory period. Now after this phase, say for some reason heart is stimulated, there may be another action potential like this. And this action potential we call as a early after depolarization. Or it may happen in the late phase before it reaching this is called the left after depolarization. So these are some of the things which are responsible for generation of the cardiac arrhythmias. Or this arrhythmia may occur, suppose there is a pathway, bundle of fish, there is an infarct over here. So it is coming, this impulse is diverted in both the ways. So since there is an infarct, it is in the refractory period, it cannot go whole side, it cannot permit this impulse to go beyond this. So this will be reactivated by this, and by this time this refractory period is also gone, and there is always, this is called the circus movement of the cardiac activities. So different drugs, I will not talk about the different drugs, I will only say the different mechanisms what I mentioned just earlier. Number one, by which the cardiac arrhythmias can be tackled. Number one, the vagal stimulation. Number two, cardiac surgery. Number three is pacemaker. And number four, the pharmacological means that is the drug. Different drugs. So, whenever these facilities are not available, say the cardiac surgery or the pacemaker, the pharmacological means the only way to treat the cardiac arrhythmia according to the situation. Now, the antiarrhythmic drugs can be classified in many ways. Number one, it may be classified according to the clinical classification. Number two, it may be action potential. The clinical classification, that means you choose the drug according to the site where it is effective. Just like some are effective in the supraventricular tachycardia. As for example, it may be your digoxin, it may be adenosine, or it may be the verapamil, or there are certain drugs which are effective in the ventricle, as for example, the lignocaine, phenytoin, these are effective in the ventricular tachycardia. And there are certain drugs which are effective in both atrium and the ventricle, as for example, beta blockers and amiodarone.